All right, today we're going to talk about navigating menopause, tips for cancer survivors. So when you're diagnosed with cancer, it's overwhelming. I've talked to many patients over the years, and it's really life-altering change. But for many patients, they're going to be cured of their cancer. We have so many more treatments available that we're actually curing cancers that maybe in the past weren't able to be cured. But one thing now we're having is a lot more cancer survivors, and there's some things that cancer survivors go through that other patients don't. Today we're going to talk about some of the tips on navigating menopause after cancer. If that sounds good to you, keep watching. Well, welcome back to my channel. My name is duPont. I'm a board-certified gynecologic oncologist, and I am passionate about educating women on how to improve their lives and how to stay healthy. So today we're going to talk about navigating menopause, tips for cancer survivors. So early in my career as a GYN oncologist, I was taught how to treat cancer surgically, how to treat it with chemotherapy, with radiation. Now we have immunotherapy. We have always had hormonal therapy. And so I got really good at treating cancer patients. But then I realized once I started practicing more, a lot of my cancer patients were doing great and they were survivors. But then there were other problems. They were having relationship issues, marriage issues, menopausal issues. And I didn't really get a lot of training on how to navigate the cancer survivor. And so I really had to educate myself on how to treat women, especially with menopause, because I realized that women were having hot flushes and night sweats. And although their cancer had been treated and they were cured, these issues were really affecting their quality of life. And I really didn't get a lot of training on, nutrition or menopause. And so I really had to seek out training for myself. I tried to refer my patients to other people, but I didn't have anyone that I could send them to that I trusted who would know how to not only treat their menopause, but also understand their cancer and understand, cancer recurrence and what things that they should and shouldn't take. And so I was like, you know what, I might as well just learn it myself. So I joined the North American Menopause Society. It's now called the Menopause Society. And I took their training and got certified as a menopause practitioner because I really wanted to know how to help my patients. And I really didn't have anyone to refer them to. So I had to become the expert for my patients. And so today we're going to talk about some of the tips that I talk to patients about as they're navigating cancer survivorship, but also focusing today on menopause and what that means for women who maybe had surgical menopause. So one of the things that I've noticed in a lot of patients that I treat, so I'm a GYN oncologist, so that means that, I treat women with ovarian cancer, cervical cancer, vulvar cancer, so mainly the GYN cancer. Now, I don't treat breast cancer, and most of us don't. There's a few that do treat breast cancer, but most GYN oncologists don't treat breast cancer patients. But I do see a lot of them because, sometimes they have other cancers. Sometimes they'll have gene mutations like BRCA1 or BRCA2, so I'll see them for that reason. And so I do have a lot of breast cancer patients in my practice. And what I've noticed with a lot of our big surgeries is that they're very disfiguring. I mean, we're getting better at having surgeries that are less invasive, that have quicker recoveries. But for some women, that huge surgery or that hysterectomy or that mastectomy really does affect them mentally. Now, not everybody has these issues, but some women really feel that they've been disfigured, they've been altered. And so for those patients, I do send them to counseling because for some women, it's just so debilitating for them. I think of it as sometimes a new normal, but for some women, they can't get past that change. And so for those patients, or if you're feeling that way, definitely seek out counseling. There's a lot of therapists that deal with cancer survivors because the issues you face are very unique and they're very important and they definitely need to be addressed. And sometimes it's just, having someone to listen because your family members or your spouse may not understand because they didn't go through the treatment or the surgery that you had to go through. I've also found that support groups are very helpful. Some patients are more willing to join a support group than others, but I have found that women that do join a support group are very glad that they did. And a lot of times they have a community of women that have gone through what they've gone through, maybe had the same surgeries, maybe had the same chemotherapy or radiation. And so it's good to join a community of people that have kind of gone through what you've gone through. I interviewed Kathleen Maxian earlier last year from the Ovarian Cancer Project, and she's got many support groups with her foundation. There are many others. There's a lot for breast cancer survivors. There's some for ovarian cancer survivors. I know in Houston, we do have several. And so definitely whatever area you're in, look and see if there's a support group closer to you. I know a lot of my patients have found, Facebook support groups, and there's some online that may be helpful. So just think about if you're having issues with your surgery and just how it changed your body. And if it's really distressing to you, seek help because there is help available. Now, second is menopause. Now, surgical menopause is a little different than natural menopause because surgical menopause is abrupt. I mean, it happens all of a sudden. I tell patients who maybe haven't gone through menopause, but they're having surgery for cancer, that, you may start having hot flashes right away. You may have them in the hospital right after surgery. And so for young women that are having, their ovaries removed at a young age, it's really distressing for them. So it depends on their cancer, whether or not they can get hormone replacement therapy. But I see a lot of breast cancer patients and some can't get hormone therapy. And so there are alternatives. There are a lot of new non-hormonal therapies that women can use. I use a lot of it. There's several antidepressants that we use for hot flushes. I use gabapentin a lot for night sweats. So there are alternatives. The Menopause Society on their website, menopause.org, does have information for women who are dealing with hot flashes, and it does have a nice little patient handout about non-hormonal therapy because some women can't get hormones because of their particular cancer, especially if their cancer is responsive, like to estrogen, then we don't want to give them estrogen. But for a lot of my patients, like my ovarian cancer patients, my cervical cancer patients, my vulvar and vaginal cancer patients, they can have estrogen. So a lot of times we'll have them see their oncologist or a menopause practitioner to know what's the right dose, what's the right route. Because sometimes we'll give it oral, sometimes we'll give it transdermal. There's creams, there's sprays. So there's many different forms of estrogen or progesterone, and it does need to be tailored to your risk factors. If you're someone that has a very high risk of heart disease, then your menopause practitioner will know, is hormones right for you because it may not be. I find that over the years, hormone therapy is very individualized. No two patients are the same. No two patients have the same cancer or same risk factors in terms of heart disease and stroke. And so all those play a part into, if you're given hormones, what routes, what doses, how long should you be on hormones. The American College of Obstetricians and Gynecologists put out a statement many years ago saying we should use the lowest effective dose for the fewest amount of years possible. So it's not my plan ever to put anyone on hormones forever. I tell my patients it's not lifelong. I do have some patients on a little bit longer than normal, but at that point it's a shared decision-making experience where we kind of tailor the duration of hormones. But for most of my patients, I do try to wean them off hormones after about 5 years. But then again, depends on their age too when they stopped. So that's a very individual discussion. And so definitely talk with your menopause practitioner. And then the other category, so the first one would be body disfiguring surgery or surgery that affects how you look at yourself or how you see yourself, and then surgical menopause, and then relationships. I've noticed that as women go through cancer, sometimes that experience brings their marriage closer. I have a lot of spouses that go to every single appointment. They're there for every treatment, every CT scan. And for those relationships, they get stronger through this treatment because it's adversity. Adversity is it brings you stronger, it tells you apart. And I have had patients where the adversity tore their marriage apart. And so if you're having relationship issues, get help, see a marriage counselor or a marriage therapist because it is a big stressor on the family. I've had patients after hysterectomy, they didn't want to have sex anymore. They weren't interested, and that caused, marital issues. And so just think about the relationship that you have with your partner, your spouse, to focus on that because, they had to go through this with you and they may not understand all that you went through, but they're empathetic. So if you are struggling with intimacy after surgery or after radiation, talk to your doctor, but also if you need a therapist, definitely see a therapist. There's some nowadays that are online that you can see that are maybe more convenient in terms of, missing time from work or driving or traveling somewhere. But in terms of vaginal dryness, a lot of times we can give local estrogen. There are a lot of water-based lubricants, and there's some very good ones over the counter. I'll have my patients try those first. If those don't help, then we'll add in an estrogen vaginal cream. And of course, it depends on the patient's type of cancer and what their specific needs are. But it definitely is treatment. If your desire for sexual intercourses change, let your doctor know, because there are things that we can do to help with that. A lot of times, we're busy in the office and we have so many patients to see in a day, we may not ask all these particular questions. So there's something that's, pressing or on your mind, let your healthcare provider know, because they do want to address it. But sometimes if patients don't bring it up, we don't always ask. And so definitely, if it's something that's concerning you, relationship is very important. We don't want those relationships to be damaged because of your cancer treatment or because of your experience through the cancer treatment. So definitely, get help if you need it, and talk to your healthcare provider. Well, I hope that was helpful. If there are any tips that you found that you want to share with others in terms of how you navigated menopause after cancer treatment, put them in the comments below. And thank you for watching to the very end. Well, that's all I have for today, and I'll see you next time. Goodbye.